Hello, my name is Katia Machado, and today I'll be talking about the roles and responsibilities of the registered nurse. This will include the recent changes and their impact on the roles and responsibility of the registered nurse, the role of the Nursing Midwifery Council in relation to the nursing practice, the implication of the Code on Nursing Practice and the role of the registered nurse, the need for effective communication in multidisciplinary healthcare settings, evaluation of the effectiveness of the multidisciplinary approach in healthcare settings. The recent changes and their impact on the roles and the responsibility of a registered nurse. In this slide, I'll be talking about the technical and scientific advantages, the social, political, economic, cultural, and ethnic factors within the registered nurse's role. The function and responsibility of a registered nurse are always changing due to a variety of reasons that influences the continually expanding and changing nature of the profession. There used to be a lot of overlap between a nurse's duty and the list of domestic tasks, but over the past few decades, this has radically altered. Due to their extensive training and reward experience, nurses now have more responsibilities than ever before. To help nurses manage medical emergencies without calling their doctors, educators are putting more emphasis on teaching them how to do so. Instead of being seen as a doctor helper, the profession is now commonly thought as an autonomous clinician with medical knowledge who can manage and provide the best outcome possible in challenging circumstances. Nurses are not able to prescribe patients with medication and make clinical judgments that carry a lot of responsibility due to ongoing and ever-changing demands brought by the increased number of patients who require greater levels of care. When COVID-19 started, nurses students suddenly found it difficult to enroll in classes and find placements during COVID-19 outbreak. Online training became a swift answer to help the overworked workforce that requires more people to provide crucial care. Many students, mentors, and teachers takes on a role and return to the clinic practice. To aid the service recovery from the pandemic, 50,000 more nurses were to be educated by 2024. Technical a quality healthcare system mainly depends on clinical record notes to preserve all pertinent clinical data and maintain records for future use by physicians who will need these notes to comprehend the patient condition. For record keeping and confidentiality purposes, paper patient charts were handwritten and stored on specific made shelves before modern technology was invented. Electronic systems have been employed to record patient information more frequently over the course of the late 20th century. This has greatly benefited the healthcare industry as notes were produced can saved in electronic call system, accelerating the procedure and enabling the system computers to store the clinical notes. Patient care. There has been tremendous growth in the nursing profession over the last few decades because of its history of adapting its surrounding. It has shown that can change within the times. Thanks to advance in the field, nursing has gone from being a poorly respected profession to one of the deserved great respect from both nurses and patients. There are four specialty categories within the nurses, which consist of adult nursing, which is working with patients above the age of 18, pediatric nursing, which is working with patients below the age of 18, mental health nursing, which is working with patients who have been diagnosed with mental health illness, learning disability nursing, which is working with patients in old age who has been diagnosed with learning disabilities to be able to give them special care when they are hospitalized. The role of the Nursing and Midwifery Council in relation to the nursing practice. In England, the organisation in charge of regulating and establishing standards for the nurses, midwives, is the Nursing Administration, also known as NMC. It evaluates the education, training, conduct, and performance of nurses and midwives with the help of its members. In December 1919, nurses were required to obtain a license that were able to practice. It has been recognized as the Nursing and Midwifery Council from April 1, 2002. As part of the system, nurses can encourage a high standard of education within the nursing profession, allowing them to continue ongoing their skills throughout their careers. Nurses will be allowed to register annually under a new regulation that will allow them to provide CPD, Continuing Professional Development Plan, throughout the year, ensuring that they are improving their clinical abilities considering their ongoing changes in healthcare environments. Every 3 years, a nurse registration must be renewed to continue practicing as a nurse. After the registration expires, the nurse is required to complete 35 hours of CPD throughout a variety of online courses, in-person learning opportunities, and other nursing-related activities. Nurses who have not reported their CPD hours and verified them to the NMC website under their unique registration code will be investigated by the NMC. Also has authority to compose sanctions, cautions, and suspensions, and striking of orders. This is to improve public protection and also rules and regulation to enable nurses to be able to follow clear systems to be able to practice within the guidelines. The implication of the code on nursing practice and the role of the registered nurse. The code of conduct consists in several statements that, when taken as a whole, capture the core of what nurses, midwives, and nursing assistants should do in order to practice in a morally upright and ethical way. The code of practice includes: you must treat people as an individual and respect their dignity. You must treat people kindly and considerately. You must act as an advocate for those in your care, helping them to assess relevant health and social care information and support. You must not discriminate in any way against those in your care. Employers and unions will be able to observe the code and act responsibly and professionally when conducting campaign at this time by enforcing it. The NMC makes sure that registered nurses and midwives are qualified and use their relevant abilities in consistent manner in accordance with the standards expecting to protect public health safety. This results in patients feeling that their private information and what they discuss with the doctors will be handled confidential, and that action will be taken if isn't done properly. Discipline might be applied if the code is not followed. Misconduct and unsuitable conduct are a couple of instances The medical professional runs the risk of losing their entire registration, of being unable to continue practicing in their job if they fail short of the code criteria. The 4 Ps of the code consist of prioritizing people. We need to respect patients individually, and respect their dignities. Practicing effectively, which is communicating with others clearly and respecting others' views. Preserving safety, which is making sure knowledge is fully acquired prior to beginning a new job. Currently recognize, take in, and evaluate the individual's normal or struggling mental health, and to take appropriate action as needed. Promote professionalism and trust. Keep a high level of professionalism at all the times to make sure you are following the rules, and to be conscious of how your actions can have a significant impact on the others. The need for effective communication in a multidisciplinary healthcare settings. Communication is crucial. It is the foundation for all other factors. If team members are not communicating well with one another, it will be difficult to properly plan for a care, make decisions, or share information. Practical obstacles to productive multidisciplinary teamwork include conflicting personalities, overlap in tasks and duties, poor communication, stress, distractions, and time constraints. When experts don't work well together, resources might be wasted. Patients might get confused and lose faith in the team, and patient care and safety might suffer. Although the staff members have complementary skills, objectives might not be met without good communication and information exchange. The best result for service users come from sharing knowledge and coordinating care plans. Staff, patients, and where necessary relative carers must all collaborate to deliver person-centered care that is coordinated within a multidisciplinary context. A patient demands can be better understood and considered in a care plan with proper communication. The NMC code repeatedly emphasizes the importance of the excellent communication for providing this coordinated, effective care. Tools are provided to facilitate communication. Clinical care pathways offer concise, evidence-based guidelines for disease management, which makes it easier to coordinate planning throughout the team because the pathway informs the choices made by healthcare practitioners. Similar to that, clinical guidelines offer a model for the team members to follow so that the patient receives the same advice regarding the treatment alternatives. This encourages communication and team decision based on the best available evidence. To connect their separate tasks and produce the best possible care for each patient, a competent multidisciplinary team recognizes and understands their roles within their respective fields of expertise, providing patients with support and that is specifically suited to their needs, as well as comprehending and the unique circumstances of each patient and creating a strategy. There are various jobs in these fields, including the following: nurses, doctors, care coordinators, social workers, paramedics, receptionists, and many, many more. The evaluation of effectiveness of multidisciplinary approach in healthcare setting. Using a multidisciplinary approach entails bringing together experts from various healthcare settings to create the best possible patient care plans by fusing their distinctive and effective system. Since we are all unique human beings, the healthcare professionals will have a wide range of abilities, approaches, and skills. Teams can come together in this way to listen to one another for the best team possible, break down each other's problem efficiently, and provide the best result for the patient. Successful characteristics of a multidisciplinary team should include a good level of team understanding and what each role and duty consists, high standards of team collaboration in order to create and maintain an efficient team, clear and excellent levels of communication within the team to be able to create the best program for the patient and to be able to achieve them. Every person within the team to be able to understand their own roles clearly, creating an easier system for the process as a whole. Now, I will be talking about the advantages and disadvantages within the multidisciplinary team. Advantages. This can improve the quality of the patient all-round care outcome to the situation. The role of each employee is to find and work procedures as streamlined as one having eyesight from multiple perspectives on the same topic to be able to come to a conclusion, which is the best suits the situation and the patient. Constantly learning from colleagues due to a different communication and handling techniques. Build a strong, interesting teams which encourage good team decision, making a better work lifestyle, also a job satisfaction. Now I'll be talking about the disadvantages. Individual will have different backgrounds and opinions and views on the topic, which could be a positive or a negative. The costs, poor communication between colleagues, lack of understanding between workers. While this system has both benefits and drawbacks, I think the benefits outweigh the drawbacks. The wonderful thing about patient-centered teams is that they break down each position into smaller, more focused roles, allowing team members to learn from one another and develop new abilities. Working in the healthcare industry becomes less stressful and more gratifying when these processes are in place, well implemented, and complemented by a professional attitude and an open-minded mentality. Additionally, it gives patients a better chance to receive the best medical care possible because it has been developed by numerous people with diverse backgrounds. And that is all for now. With this project, I have gathered more understanding of the roles and responsibilities within a registered nurse role. I hope you have too. I would like to say thank you for you taking your time to view my presentation.